Welcome to Global Products, NewMURx EHR and Practice Management Software for Ophthalmology. This is the main login page. NewMURx modules such as reception, assistant doctor, or optometrist can be accessed with respective login credentials. Here we will use the test or demo doctor credentials. Login to NewMURx. What we see here is the main navigation page with a detailed navigation menu on the left and a dashboard with shortcut panels for quick access to patient registration, that is register patient, appointment scheduler, patient to consult, patient for visit, registering walk-in patients, viewing images stored in the software, refill prescriptions, lab test results, task list, a shortcut for billing, and the inventory module. To register a patient, we click on the register patient panel to register the details. Next is the appointment scheduler, where the doctor can see his appointments for the day, for the current day, or for the entire week. Then patient for visit panel shows the list of patients arrived at the clinic or scheduled for consultation for the day. Walk-in patients to schedule an appointment for walk-in patients for the day. Patient to consult panel, which shows a list of patients for whom the consultation is to be done and their clinical data is to be recorded. To record patient clinical data, click on the patient to consult panel. It shows a list of patients for consultation for the day. Click on the name of the patient to open the OPD and subspecialty modules. All patient clinical data can be entered, selected, saved, and viewed in a single page in this general ophthalmology or OPD page. The topmost part shows the patient details such as his name, his contact number, gender, address, visit ID. Today's patients will be the list of patients for whom consultation is to be done. Next is starting with patient medical and social history. To record patient medical and social history, click on Add Update and select the required or appropriate choice. Click on Save. It will show the display the selected options under the patient medical and social history. To record examinations and their findings, click on Add Update. It will show a list of all examinations on the left hand side of this page under examination and the corresponding findings on the right hand side. So for chief complaints, the options for chief complaints are shown on the right hand side. Can select the chief complaints and click save. Similarly, any other examination and its findings can be recorded. Fundus. Any details, if needed to be added, can be entered in free text format in these text boxes provided against each of the findings. And click on save to save the selected options, and they will display on the same page. Coming to diagnosis are recorded using ICD-10 codes. Click on add. This opens a new page for recording the diagnosis. If the diagnosis is other than any ICD-10 code, then selecting diagnosis non-ICD, the diagnosis can be typed in free text format. So at present we will select from the ICD-10 codes. Typing in the keyword will show the list of options. For example, for cataract, it will show all the diagnosis for cataract along with the ICD-10 codes. Similarly, for retina, glaucoma, any of these diagnoses can be selected and they will be saved. So we will select senile cataract. The diagnosis type can be selected by clicking on the radio button if it's admitting, final, inclusive, or working. Any comments, if any, can be entered in free text format. The onset date, if required, can be selected and click on save. Current medication, if any taken by the patient, can be entered in free text format in under the current medication. Now NewMURx has a built-in drug database. From wherein drugs can be selected and a prescription can be downloaded and a printout given to the patient. To select the drug, click on add. And type the name of the medicine. Dosage can be specified, the number of drops, the frequency, number of days, and comment can be added. So from this list of drugs, the drug can be selected, the dosage, frequency, number of days. Any comment or advice can be typed in free text format. Save. Prescription can be printed by clicking on print prescription. And it will get saved to the desktop and a printout can be given. Glass details or spectacle details can be recorded in this same screen. So clicking on distance or near, the values can be selected from the given chart. Save. Similarly for near. The type of glasses can be selected from the options given below. Such as bifocal, progressive. Last suggestions, if any, can be typed in free text format. Similarly for clinical vision. Save. Autorefractometer readings can also be recorded in a similar fashion. Any further advice to be given to the patient can be entered in free text format in the advice box. After entering all the information, click on save to save the recorded information. This information is saved against the patient for this particular visit ID and can be viewed during any other follow-up visit for the patient in the same format in a single page. Patient clinical data for any specific subspecialty can be recorded by clicking on subspecialty. The subspecialties included are cornea, cornea follow-up, injury, retina, keratoplasty, glaucoma, and pediatric. History of presenting illness can be entered starting with cornea. History of presenting illness can be entered in free text format. Uncorrected visual acuity can be selected from this drop down menu. Similarly for pinhole and for BCVA. Anterior segment examinations and their associated findings can be recorded by clicking on this button such as lids. It will show the name of the examination selected on the left hand side and the associated findings on the right. Which can be saved. Intraocular pressure can be entered in free text format. Operative details with the date. Differential diagnosis diagnosis, keratometry readings or information, the topography, specular macroscopy, and rest of the information can be entered. The images incorporated in NewMURx can be marked up with the built-in image editor. Click on View Edit Cornea, which will open the image editor. Images can be marked and saved. Image is edited and saved. It will display in the main page of subspecialties as can be seen. Now for cornea subspecialty, the other information can be added as required. Other subspecialties in the subspecialty module are cornea follow-up, injury, wherein information such as history of presenting illness, operative details with the date can be entered, examinations with their findings can be entered and saved. Other information such as classification of injury, the ocular trauma score, Roper Hall classification data can be entered and saved. Then coming to the retina subspecialty, BCVA readings can be selected from the drop-down menu, such as pin as well as the pinhole vision readings, color vision, diagnosis, examinations and their findings, complete anterior segment, the retina exam, OCT interpretation, the injection numbers and the date can be recorded. The next subspecialty is keratoplasty. The image can be marked up using the image editor as shown before. Information regarding keratoplasty such as fundus, axial length retinoscopy, intraocular pressure readings, diagnosis, operative details, such as cornea status, time of preservation, knots buried, post-operative information, and the image can be edited, recipient and donor follow-up can be recorded. Coming to the glaucoma subspecialty, specific medications and the dates can be recorded, patient history, ocular examination readings. Again, image for glaucoma can be edited and marked up using the image editor. Intraocular pressure informations or readings for Sheard's eye care applanation digital, fundus examination, OCT information, perimetry can be entered and saved. NewMURx also includes pediatric ophthalmology subspecialty, which wherein the information for complaints, durations, birth history, vision, IOP, color vision, squint motor assessment can be added, recorded, and saved. Once all the information has been added either to the subspecialty or general ophthalmology part, the consultation for the patient can be closed for the day by clicking on close consultation, and the consultation will be closed. For generating reports, in the left hand navigation menu, click on reports. A drop down menu will open which will show the listing of options for generating reports. Click on patient diagnosis list, then select the diagnosis for which a patient list is to be generated. Select the from date, search. It will show a list of patients with the senile cataract diagnosis, the patient ID, encounter ID, and the recorded date and time. When you click on print, a report will be generated. Similarly, a medication report can also be generated from within NewMURx for the specific medication. So in the medication box, click on the search icon. In the description, type in the name of the drug for which the patient list is to be generated. Select the from date. Click on search. Since there's a single patient, if you click on print, it will give the list of the patient with the patient ID, the medication name, patient name, his visit or encounter ID, the particular medication, the associated diagnosis, and the date on which it was recorded. Finally, a cash bill can also be generated if required from within this software. For that, click on Super Bill. It will show the list of patients for the day for whom the bill is to be generated. So click on the name of the patient and a new window will open which shows the charge type consultation. All these charges, consultation procedures can be customized by the doctor or the clinic, and the charge descriptions and the amount to be charged can be customized by the doctor or the clinic as per their requirement. So this is about the NewMURx EHR and practice management software for ophthalmology. This particular software can also be accessed using an iPad or a tablet.